So
Great. Thank you. Well, thanks for inviting me to present to your group. It's always nice to learn about more states who are interested in implementing something along the lines of recovery-friendly workplace. So I did adapt these slides from a presentation I did recently. So some of this might be like you kind of already get it or understand. So if anything seems redundant, you can also look at it through the lens of this is kind of how we can message it to workplaces and the public and to some of those other stakeholder groups. So how much do you want me to do a recap of like substance use disorder and recovery definitions? Do you want me to skip those? Or should I include those?
Dorothy and Jeannie, I think that'd be up to you guys.
Any information is great.
Okay, so I'll just plan to kind of give us like a broad understanding of kind of these terms and what it is we're talking about. I'll talk a little bit about recovery-friendly workplace and why it's good for business and also employees. We'll get a little bit more in depth into RFW process and culture. And then this is something that we always present on, which is just resources. So I might not do a full like dive into everything, but you'll have, I'd be happy to get you like a PDF of my slides so that you at least know kind of where to find different parts of the information. Because I would also love to leave some time for questions and just like dialogue. So what is substance use disorder, which we also call SUD, which you might be more familiar with the term addiction. So substance use disorder is another term for addiction. It's actually what is in the DSM, whatever number we're up to now. Is it 5? That almost seems like we must be higher than that, but 5 is coming to mind. But the American Society of Addiction Medicine says that this definition comes from 2019, that addiction is a treatable chronic medical disease involving complex interactions among brain circuits, genetics, the environment, and an individual's life experiences. People with addiction use substances or engage in behaviors that become compulsive and often continue despite harmful consequences. They go on to note, though, that prevention efforts and treatment approaches for addiction are generally as successful as those for other chronic diseases. So I just like to highlight that, this is a complex health issue. It's a public health issue. It's not something that somebody chooses to have, and that this element of continuing use despite harmful consequences, which can seem puzzling from the outside, is actually a symptom of this specific health condition. And then along with that, so what is recovery? So these definitions come from the collective wisdom of people in recovery, researchers, and thought leaders. And so this first definition comes from a recovery summit that SAMHSA, which is the Substance Abuse and Mental Health Services Administration, held a decade ago. And they just for the first time did their second ever recovery summit, which I was really excited to attend. And we actually revisited this definition. But they came up with recovery is a process of change through which people improve their health and wellness, live self-directed lives, and strive to reach their full potential. And then we have this other definition that comes from Ashford and some other researchers, that recovery is an individualized, intentional, dynamic, and relational process involving sustained efforts to improve wellness. And so in both of these definitions, it's really interesting because we actually don't see the term substance referenced, but we do see process and wellness highlighted in each of these. And so a big tenet that we kind of ascribe to at Recovery Friendly Workplace is that, recovery needs to be based and housed in the individual and driven by them. And if you've ever done like Recovery Coach Academy, which trains people to be recovery coaches, something you'll hear a lot of is that a person is in recovery when they say that they're in recovery. So every kind of journey looks different. And if you're working in the kind of job placement space, I'm sure you're familiar with that as well, and the importance of kind of meeting somebody where they're at. Okay, so a little bit more about the Recovery Friendly Workplace Initiative now that we kind of know what these terms recovery and then substance use disorder mean. So the Recovery Friendly Workplace Initiative is an initiative of Governor Sununu. It was launched in March of 2018. We are administered by a nonprofit organization called Granite United Way in partnership with the state of New Hampshire. And really, it's an initiative that's designed to promote the health, safety, and wellness of New Hampshire workplaces, employers, employees, families, communities, all those kinds of different groups. And more specifically, we do this by empowering workplaces to provide support to those who are impacted by substance use disorder. So this could include people who are in recovery, people who are seeking recovery, not yet in recovery, or people who are impacted due to having a loved one who has an SUD. A huge part of this work involves challenging the stigma around substance use disorder and behavioral health, and just making people know that it's okay to come forward and talk about these things. And overall, we feel that this approach has benefits such as retention and recruitment. And I'll actually be able to share some results from our first ever All Recovery Friendly Workplace Business Survey with you in these slides. So I'm excited about that. So just a little bit more about our org chart and how we're kind of organized. So obviously we all kind of report to the governor's office. Again, we're administered by a nonprofit organization called Granite United Way, which is like an affiliate of the larger United Way. You know how like Susan G. Komen works, like there's Susan G. Komen National. I always hesitate to like say how connected they are because I don't know all of the inner workings of that, but I know enough that they're separate entities, but they're kind of affiliated. But in New Hampshire, it's called Granite United Way. That's kind of our subset of the larger United Way brand. We're overseen by an advisory council that's made up of business leaders, people from healthcare, people from the recovery community side of things. And that's nice because it's kind of like a built-in focus group to advise on and provide high-level guidance on our initiative. And then we currently don't have an assistant director. I was promoted from that position. And then I'm serving as the multi-state liaison. And we have, I oversee 4 fabulous staff members. They are what makes this initiative tick. Our staff position is that of the Recovery Friendly Advisor. And those are the people who are working one-on-one. Every workplace who signs on to the initiative gets assigned a Recovery Friendly Advisor who's really helping them work on the development of their culture. And then we also partner with our 13 public health networks, and we have a variety of recovery community organizations in the state. And so if you're not familiar with recovery community organizations, they provide really low barrier, no cost, peer-based, non-clinical supports. So in comparison to treatment, which usually has a price tag associated with it, and it's very kind of clinical and top-down, a peer recovery organization is more like lateral and typically like lower barrier and not doing clinical, but rather that peer-based work. So really what we were trying to do with the program was leverage existing systems, break down silos, and really wrap the workplaces in support. We started with 25 early adopter workplaces, and now we have over 330 who are participating with us. So some key accomplishments to date. So we're fully staffed. So when we started out, we had our director, Shannon, and then 3 recovery friendly advisors. So we've grown quite a bit since then to now have 4 recovery friendly advisors, myself as the director, and then Shannon provides very high level guidance around the initiative. And then we were able to secure additional funding through the New Hampshire Community Development Finance Authority, and then also 2 federal funding opportunities through CARES Act and then ARPA dollars to build relationships with our partners and really kind of deepen the work we were able to do with them, and then in turn the work that we're able to do with our workplaces, especially as it relates to kind of boots on the ground peer supports. I talked about the number of workplaces and how that's grown. So our over 330 participating workplaces represent over 86,000 employees. We've engaged people in RFW activities over 24,700 times. We've built out over 16 different trainings, and we've trained over 200 businesses. We've made connections to 25 other states, and we've developed a lot of different marketing and informational assets, including 7 different employee testimonials. And we are working toward an evidence-based certification through the New Hampshire Service to Science process, and our all RFW business survey is part of that. And I know that, no, actually I haven't mentioned our website, but this screenshot on the right is just some of the logos of our participating workplaces. And if you go to recoveryfriendlyworkplace.com and click on designees, you can see a few more logos from those who are designated as recovery-friendly workplaces. So a little bit more about how we support our recovery-friendly workplaces. So the first thing is we offer a really customized approach within this one-page checklist process we have that I'll go through a little bit more in a bit. It's really important, just like when we're working with somebody in recovery, when we're working with a business, we try to meet them where we're at within our general process, and kind of really listen to their needs and let them steer what things look like. We get businesses connected to statewide, local, and even national resources. We curate materials and tools for each workplace. We provide support for employees and also those family members. If a workplace is interested in including this approach to include mental health, we can do that as well. We provide no-cost trainings. That's actually one of the things we found that our workplaces were most interested in, which surprised us a little bit, that they were so hungry for training. We can share some policy resources and samples. We get people connected to peers. So for example, if I'm a manufacturer and I have a really specific like HR question, it might just be best for, say I was the advisor, it might be best for me to just get them connected to another person in manufacturing, because they're going to be able to have a very different, much more specific kind of conversation than really any of us could have with them. We can provide support around forming an RFW committee or conducting a survey to get a little bit more information about workplace culture. We provide workforce development connections, and we really provide ongoing dialogue and structure to keep workplaces moving along this continuum of culture change and to help keep them from stalling out. We've really found that staffing to be such a critical part. Like, people build toolkits sometimes, and I think it's a great idea, and it's great to disseminate it. But what we found is that to keep workplaces kind of engaged in doing the work really requires that one-on-one recovery-friendly advisor assignment. And maybe it would look different in different states. And in terms of years, sorry,
Sam,
yeah.
Could you go back to the previous slide for a second?
Yeah.
So, 4th one down, you talk about offering support for employees and loved ones. Can you tell me a little bit more what that means? Are you offering direct service support, or you're like, what does that mean, support for employees?
Yeah, I think more so that we work with management and HR and leadership so that they can provide support and know how to provide support to employees and impacted loved ones. However, I will say that part of our education is part of our process is that we ask that employers get connected to their local recovery community organization so that they are more in touch with what that direct support might look like. And then through our CARES and ARPA funding that we were able to secure, like right now we're contracting with 8 different nonprofits. And so some of them are providing more of those direct peer recovery supports. Like one of them's done some journaling workshops. One of them offers recovery coaching to a certain number of businesses. One of them is doing these like recovering together cafes. So it can look different, and it depends on the funding in the region a little bit, but at kind of a minimum, we're having conversations with the company around how they can provide supports and kind of giving them examples of things that they can do and bring in.
Okay, thanks for clarifying.
Yeah,
thanks for clarifying that.
Yeah, one cool thing is that one of our employers, Chameleon Group, for example, brings a recovery meeting on site. And then because I'm part of Grant United Way, we also have a pilot program around workplace wellness that combines financial literacy options with on-site resource coordination with recovery-friendly workplace. There is a fee associated with that kind of combined offering, but our program, everything we provide is at no cost. But there's creative ways to do that. So I like that you're asking about that. Why should employers get involved? I mean, I probably don't really have to convince anybody here, but just so you know kind of how we're pitching to employers. So we know that there's significant costs associated with not addressing substance use disorder in the workplace. So National Safety Council partnered with NORC at the University of Chicago, and they have a great tool called the Substance Use Employer Calculator. And then what we like, though, to make sure is that people aren't just thinking of like, oh yeah, like substance use disorders out there. And like, if I hired somebody who was in recovery, it's like, no, you already are. Like, it's already here. You already have people who are in recovery, people who probably need help. You have impacted loved ones. We know that about over 20 million people, or about 10% of Americans, have a substance use disorder. One statistic shows that about 9% resolved a substance use disorder in the past year. And we know that nearly 1 in 2 people are indirectly impacted by substance use disorder. So that's a really high percentage of the workforce that's impacted in some way. And we also one of the biggest benefits we've heard about from workplaces is that they're able to attract and retain talent through being a recovery-friendly workplace, because they have the tools in place where if an issue arises, instead of just having to say like, well, you're fired, they can say like, no, I've learned of a different way to handle this. So for example, through like a leave of absence and a return to work agreement, that would be one of the most kind of common policy measures we might see implemented. And then this statistic's a little bit old now. Actually, it's from June of 2020, but during late June, about 40% of US adults reported struggling with mental health or substance use. The American Medical Association found that over 40 states had seen increases in opioid-related mortality. Nearly 1 in 5 people had reported heavy drinking. And the organization, Mental Health, I think it's called Mental Health America, had seen a 500% increase in self-directed mental health screenings. So, I mean, the issue is here, like, we can try to ignore it. I think sometimes people feel like when they talk about it, maybe things get a little bit worse. It's not that anything's getting worse. It's just that you're talking about something that's been like under the surface. But what we know from workplace and wellness and productivity and retention is when things are under the surface, they're still manifesting, whether it's people, getting distracted or presenteeism or absenteeism. So the more that we can actually bring things into light and support people, it might feel kind of like it's more, but that's the way that you're genuinely going to make it better for people and better for your bottom line, really. And then this is just showing the increase in the prevalence of depression during COVID as compared to before. So the blue is during COVID, and you can see it like increasing in severity, and the percentage of people reporting none really decreasing. We also know that workers in recovery save companies money. So they avoid over $4,000 in turnover and replacement costs. They miss fewer days per year than workers with an SUD, and they save a company over $8,500 on average. We also know that people in recovery, as compared to the general workforce, tend to outperform or overperform them as well. So they miss fewer days and they have a lower turnover rate. And then these are the results from our first ever all RFW business survey. And so I hope I can zoom a little bit. So kind of our tagline is that recovery-friendly workplaces are good for employees and good for business. And so what we did was we surveyed all of the points of contact of our that we have in our kind of internal tracking system. Our sample size was 76. And so we asked respondents, as a result of participating in recovery-friendly workplace, how had the following changed? And so these following percentages of people indicated that they had seen some amount of an increase in these different items. So 70% of points of contact said that supervisors' confidence in knowing how to respond to an employee concerned about substance use had increased. Really a lot of increase around knowledge of resources available for SUD treatment and recovery. Employees are feeling much more willing to discuss their well-being in the workplace. We have some great statistics around Narcan. Over 40% of people indicated that employees' knowledge about how to use Narcan had increased. About over a third said that accessibility, so actual access to Narcan in the workplace, had increased. Willingness to hire people in recovery had gone up. And then people ask about this statistic quite a bit, so we did want to include it. So almost a third said that staff recruitment, retention, and/or productivity had increased. I will say that that's really a longer term outcome. And so our logic model has short, intermediate, and long-term outcomes. And given that our program was just launched in 2018, not even fully up and running until 2019, and then the pandemic hit, we're right where we would want to see, or even beyond, in terms of kind of what we're seeing for outcomes. And then also, I think that certain things like being able to, or being willing to hire people in recovery, better morale and satisfaction, knowing these resources and things like that, that's going to contribute to recruitment, retention, and productivity. And just whether maybe the business is directly linking it to recovery-friendly workplace is like another question. But it'll be really interesting to see how these numbers might shift as we do this survey, hopefully every year or every other year. And then we saw like a really high level of engagement with the initiative. These are just different RFW related activities that they could be engaged in. And then I'm trying to, well, okay, there we go. And then page 2, whoops. I just wanted to read this. RFWs are also changing their policies to better support those impacted by SUD, which research shows will help employers recruit and retain a healthier, more productive, and more motivated workforce. And I put those citations down there to that research. So almost 40% of RFWs indicated that as a result of participating in RFW, they've made changes to their substance-related policies to better support those impacted by SUD, for example, through leave of absence and/or return to work agreements. And then we also asked businesses, what are the most meaningful ways that your workplace has changed since becoming a recovery-friendly workplace? And then here's some of their responses. Sorry, I'm trying to zoom in. I like this simple one. Employees know we care. I'm just like, yeah, that's what it's all about. This one talked about attracting and keeping employees, becoming more supportive, flexible, treating people on a case-by-case basis, decreasing stigma down here, increasing compassion, more respect for management in the company. So overall, really pretty remarkable that like we're blown away and so humbled and grateful that our model has really like touched on something. Like it was designed with this blend of the governor's perspectives as a former business person himself, which I think was critical. And then my boss's perspectives in public health and research around workplace wellness and prevention. So preventing substance use disorder or preventing it from progressing in severity. And it's like, it seems like we're onto something. So we're really excited about that. This is a video we have that showcases a testimonial from one of our employers, which is Chameleon Group. But I think that I will maybe save the video for later, unless would you all like me to play it? I don't know how well it will play.
I love the video, I have to say.
You love it. Let's see. So this slideshow is not embedded, but if I click on it, I think it should take us to the link. Do you want me to try?
Sure, it's only 3 minutes, right?
Yeah, it's not very long. Let's see. Can you see and hear that all right?
Yeah.
Okay, perfect. Let's do it.
Chameleon Group is an outsourced inside sales company. We do provide inside sales services for third-party companies, predominantly in the technology space. I'm not sure that we ever decided to become a recovery-friendly workplace. I think it decided for us. We had several employees, one in particular, who had some attendance issues and ultimately led to her dismissal. A couple of years after that fact, the individual called us back and wanted to be considered to be rehired. She said to me, well, the reason why I was undependable was while I was working for you, I was hooked on heroin. Long story short, we agreed to bring her back on a trial basis. She excelled. So we kind of looked at it as a potential source for employees that other folks might not have been looking for.
The choice of my employer becoming a recovery-friendly workplace means the world to me. I had first heard of it while I was in a 30-day rehab. I never actually heard of any companies doing anything quite like this, and it was an overwhelming sense of relief.
Someone in recovery who is getting back into the job force and doing interviews. There's a lot of concern there with gaps in employment or how honest you need to be in these interviews. If you're applying at a place that's recovery friendly, there's not so much concern there. Past interviews, typically I would bend the truth or, make a resume that fills in gaps on my employment history. But with this, they had told me just be honest with them. I kind of struggled with it at first because that was new to me and I was new in recovery at the time. It worked out and I couldn't be happier. In supporting my recovery during COVID, there was constant communications.
Even though we were 20, 30, 40 miles apart, it was still like we were all in the same kind of room.
The most rewarding thing about being a recovery-friendly workplace is that we see these folks go from being perceived to be a net drain on society to be a net contributor to society. I take every opportunity I can to talk to other local businesses about recovery-friendly workplace environment because I'm such a big believer in what it does for our community and what it can do to help positively impact the lives of folks who suffer from SUD.
Yeah, that's a great company, Chameleon Group. That's the one that brings the recovery meetings on site. Just a little bit more about our process and RFW culture. So I definitely wanted to hit on the checklist because this is kind of what our program is based around. So we have this one-page checklist. So this is what our workplaces need to do to become designated as a recovery-friendly workplace and then maintain that designation. So we have an initial set of required components, additional required components, and then optional components. So our initial components, our business needs to submit a letter of interest online stating that they would like to become a recovery-friendly workplace. And we just get a little bit more background information on them. And then at that point, we would have one of our recovery-friendly advisors come out and do a full orientation to the program with them. And we're kind of assessing culture, and like the level of stigma and kind of seeing what motivated the workplace to join. Then we ask the business to do a declaration stating their commitment to RFW and its principles and getting that out to all of their employees so that they know that they're a recovery-friendly workplace and what that means. And then we get them an initial recovery-friendly workplace designation. We do a swap of branded elements, and then we move into this additional middle section of the checklist, which needs to be completed within a year of getting designated. So that looks like getting information and resources about recovery and well-being out to their employees, getting connected to their local recovery community organization. So we talked about that element a little bit before. Reviewing their substance-related policies on an annual basis. So we don't mandate that they create or change policy, but we certainly invite them to review it with a recovery-friendly lens. And then if they are interested in changing policy, we do have some of those samples and templates that we can share. And then we ask them to do some kind of education and training within the year. So we have over 16 that we can provide at no cost to them. If they have another training that kind of checks the box, so to speak, on what we're looking for, they're welcome to do that as well. So for example, like mental health first aid would count. That has a component on substance use disorder as well. And then we asked that they do a designation renewal form at the end of the year. So we would go through each of the checklist components and talk about what they did to meet each item. And then there would be a section for reflections and setting goals. And then basically the process would just kind of, the middle part of the checklist would repeat each year. And then optional components include forming the RFW committee, getting involved in the community, and then those customized implementation strategies, some of which we've been talking about, like bringing the recovery meeting on site, maybe hosting something, maybe giving back if I'm like very evolved in this space, becoming that peer mentor to another workplace. There's a lot of ways that that could look. Here's some of our trainings. I've broken it down by format here. So in person or online, self-paced, which would be through our learning management platform. And then we have a series of new content, which is currently online only. And when I say in person, it means live time. So it could be in person or live time on Zoom. I'll let you kind of read through those, but I do want to draw attention to a couple. So we can do a Narcan training and get Narcan distributed, which is really cool and really powerful. We have 2 different panels. We have what we call our lived experience panel, which is people who are in recovery or who've been indirectly impacted, sharing their experience, strength, and hope around substance use disorder and what it's like to be in recovery and what their lives were like before. We might also include impacted loved ones on that panel. Then we have what we call our business panel, and that really focuses on convening people in HR and managers to talk about what recovery-friendly workplace looks like at their workplace, and talking about especially processes, policies, practices, and outcomes, because people often have questions on that. But sometimes, like I said, it's best to get people connected to other businesses. And then really what we're going for is a culture of support. So this came from a former employee of a recovery-friendly workplace. And the only reason it's former is because he decided he wanted to go into the field. So now he's a co-owner of his own recovery homes. So he went from being incarcerated to now being a business owner, which is pretty cool. But he said that every time I walk into work, Gen Foot, and see that symbol, the recovery-friendly workplace symbol, it gives me a little more hope that people do care. And then I wanted to just provide some examples of kind of some of the education resources that we provide to businesses. So an example of like a part of our training. So when we do our substance use disorder and stigma 101 training, we go over person first, person centered language. So that's a slide showing that. And then we like to always cover our New Hampshire resources, which really focuses on our 211 number, which is an information and referral number, which interfaces with a system here called the Doorway, which is basically 9 different hospitals. If I'm a person needing help accessing treatment, I can call 211 and get connected to one of my 9 doorway systems. They can do a centralized intake with me and help me navigate my treatment options and then my ancillary follow-up supports. And then, of course, we've talked a lot about recovery community organizations today. And then we have a video. I actually need to change that out because NH Recovery Hub, that web link was updated. But we have a video talking about how 211, the Doorway, and RCOs partner to serve those impacted by substance use disorder. Actually, if you click on this slide, it'll bring you to that video. A little bit of information. This is just kind of a for example, some content that we'll present on what employers can do to implement a recovery-friendly workplace. So the first thing is to kind of develop and implement, think about the process that you're going to use when you're rolling this out. For example, are you going to form an RFW committee? Are you going to do a survey to get more information? Is your workplace a little less formal? Are you going to have conversations with people? Are you going to do listening sessions? You know, just thinking about, do I have an idea of process? Then we always encourage parity in policies because substance use disorder is a health condition. So treating it in the workplace as you would any other health condition. So for example, if someone really needed to get to a doctor's appointment for diabetes and you let them stay on the clock, then maybe if somebody really needed to get to a recovery meeting and that week they weren't able to go in the evening, maybe consider letting them stay on the clock to go to their recovery meeting. Conversely, if you had people take off, parity, that's kind of what we're going for. We do have one employer who will let his employees stay on the clock when they're doing their recovery supports, because he really looks at it as part of their job is their recovery, and that they need to maintain that in order to be able to keep being employed. Training supervisors, you really want to make sure that if you're a recovery-friendly workplace and you have that messaging coming down, that your supervisors are aligned with that and they know what that means, so that they're supportive, so that people aren't being told it's a supportive environment and then maybe encountering supervision that's being stigmatizing. Reducing injury risk. So there's a whole other field about, alternatives to pain management. If someone is injured, reducing injury risk to lower the likelihood that somebody would be prescribed something that's habit forming. Participating in drug take-back events. That's a great example of a prevention activity. And then, of course, doing Narcan training and carrying Narcan on site. Then we just have a couple of case studies. So this comes from one of our champion RFWs, Hypertherm. This just shows different pathways to support that an employee can pursue there if they're impacted by SUD. They're really kind of a gold standard. We understand that maybe not everybody has resources or an organization that's this large that would allow them to provide all these different pathways. But I just think it really illustrates that multiple pathways to support concept that we really try to embrace. So people could go to human resources, they could go to their team leader, they could go to their EAP program, which they actually worked with their EAP program to bump up the number of counseling sessions offered around SUD. And they also made sure that they were better integrated with the local resources. They also have peers trained as recovery champions who basically know of the key recovery resources in their area and can have a conversation around getting people connected there. They also have substance use disorder resources on their not only internal but also external website. And they also have these really cool resource cards. And then they also have an MLADAC who does offers a couple of hours of support on site each week. So a LADAC is a licensed alcohol and drug counselor, and an MLADAC is somebody who has a master's in that. Here's another case study. It comes from one of our manufacturers, GenFoot. So since they had become a recovery-friendly workplace, 5 employees had come forward saying that they needed help. They went on to hire from local recovery homes. 2 of those people became shift leaders. One of them is pictured right here speaking, Sean. They formed a helping hands committee to kind of help steer the implementation of RFW at their workplace. And they saw decreases in things like accidents and injuries, lost days, and light duty days, which you can't really, like with trends, you can't really prove causation, but they felt that definitely recovery from the workplace was part of that. And then just the resources. So we kind of talked about this. I updated the links here. So you can access that second video there. And then in terms of resources beyond New Hampshire, I always encourage people to see if their 211 interfaces with substance use disorder supports. So this screenshot comes from Maine, just showing that theirs does. For example, I like to reference virtual all recovery meetings because it's very accessible if people are equipped with the internet. And so all recovery meetings are for people in or who are supportive of recovery. They welcome people from all recovery pathways with any behavioral health concern. And then they include specialized groups for family members, LGBTQ+, women and mothers, and those interested in harm reduction. And then I also have links if you'd like to learn more about this concept of multiple pathways to recovery, including a variety of different meeting types. So sometimes people think of meetings and they think 12-step like AA or NA, which that's great. That's a pathway a lot of people use and hold dearly, but for some people that pathway doesn't work. And so I just like to provide people with information that there are other pathways out there so that if that one's not working for you or someone you love, don't give up. Maybe they just haven't found the right pathway for them yet. And then you can look for peer-based agencies, and I just gave some search terms. And then there's a book I really like. It's called Beyond Addiction, How Science and Kindness Help People Change. Really good, especially if you're a loved one trying to support someone with a substance use disorder. SAMHSA has a couple of great resources. So they have a treatment locator that links to both substance use disorder and mental health providers. They have a national helpline that provides referrals to SUD and mental health treatment, support groups, and community-based organizations. Then there's this national directory of recovery community organizations. And of course, working with you all, you probably have your own local resources. So it's always nice to be able to kind of weave these together so that if you're doing a presentation, you can like provide education on local and state resources, and then, but maybe you're reaching, your audience ends up extending beyond your state. That's why I like to include some national ones, because I can't speak to everything in every single state. Then, of course, there's the American Foundation for Suicide Prevention, the National Alliance on Mental Illness, and then I need to update this now with some information on 988. And then Mental Health America, you can do self-screening assessments, and there's follow-up resources. Mental health first aid training can be a great resource. Just wanted to put a little bit of information about the National Community Practice, which some of you are already involved with. But we have a national community of practice where we convene entities doing RFW related work to foster collaboration, promote synergy, exchange best practices, kind of navigate shared challenges. And we've held, I think we're going to be holding our 5th one. We have over 200 people on our distribution list. We have the governor to governor letter that's been developed. I need to update some of this, but if you wanted to join that, if you're not already on it, you could shoot me an email. It's really for people who are looking to kind of do implementation around recovery from the workplace. And then here's my contact information. Follow us on social if you'd like. That's a nice place where we post kind of like more like live time updates and more examples of things we're doing with workplaces. We have our website, my email.